So um, now we'll move on to Teresa. I'm very pleased to introduce Teresa Lau, who is an acupuncturist and traditional Chinese medicine practitioner with over 15 years of clinical expertise. Her journey into holistic healthcare began in health policy research, where she identified critical gaps in conventional medicine's approach to supporting health and wellness. Inspired by personal healing experiences with TCM, Teresa founded TLC Medicine, an innovative acupuncture and integrative medicine clinic in Toronto's East End. Specializing in complex and chronic conditions, including autoimmune disorders, Teresa combines Eastern and Western modalities to deliver true healing to mind, body, and spirit. Her holistic approach and expertise in managing challenging health issues have established her as a trusted practitioner in Toronto's healthcare community. And with that, I will hand it over to Teresa.
Thank you, Rihanna, and thank you, Bára. That was such a powerful, moving reading, and it really just spoke to me, and really, speaks to the courage and resilience that's needed to live with an autoimmune condition and other chronic conditions. These are the types of conditions many of my patients come in with. And, if I could sum it up in one word, what does it feel like to live with a condition like this? And that would be, unpredictability. It's really, one of my patients that said, you never know what you're going to feel like when you wake up in the morning. She says, you could have gone to bed feeling fine. Maybe there's just a twinge in your right knee, and you wake up the next day and now there's crippling pain in your hip for no apparent reason at all. You didn't do anything different yesterday, yet your body just seems to have its own agenda and you're just being dragged along with it. Another patient of mine said, I just don't feel like my life is my own anymore. A lot of my patients have gone from one doctor to the next, one specialist to the next, hearing different opinions, conflicting opinions, or even worse, just having no one believe them that they're actually suffering. And perhaps, maybe they're given a prescription for one medication or two or a dozen, and you can't even have breakfast because you're just swallowing a bunch of pills every morning instead. And this is the reality for a lot of people who are struggling with chronic conditions like autoimmune disorders. It's just a world of misdiagnosis, underdiagnosis, or no diagnosis. The journey to find an answer can take years. I'm not talking about one or two, it could be, 3, 4, 5, 10 years even. And, once they get a diagnosis, maybe they get help. And often the help is really just another pill and maybe a second pill to help you deal with the side effects of the first pill and so on. Or maybe they don't get anything at all and they're just being told you need to exercise more, or maybe you should eat better, sleep more, reduce your stress, don't do this, don't do that, or I'm sorry, you're just going to have to live with this. And imagine hearing that, that you're just going to have to live with this, when this means potentially there are days where you just can't even get out of bed. It's just so debilitating. And that spills over into your social life. That starts to crumble because, how can you commit to plans when you don't know how you're going to feel next week or, tomorrow? And the worst part of it is you don't look sick. So, unlike someone who, had a fall and broke their leg, they're in a cast. There's a visible sign that you're suffering, right? But Uh, for many people who live with autoimmune disorders, chronic pain, fatigue, you can't see that from the outside sometimes, right? There could be someone sitting next to you on the train and you would never have known that they're suffering so much. But just inside battling this chronic pain, the overwhelming fatigue, the brain fog that's so thick that you just really cannot complete simple daily tasks. That's just really, really debilitating. And I hear this day in and day out from my patients. And I like to tell people that as TCM providers, acupuncturists, we specialized in the lost hope type of cases, right? These difficult, complex conditions where oftentimes doctors have already told them, this is all we can do for you. Just deal with it, live with it. And my answer is no, you don't. You just haven't found the right help yet. Because what the conventional Western medical model, the way that they see health is very different from the way that we as TCM providers see health. I'm sure everyone has the experience of going to your doctor and you've got one problem and okay, we'll refer you to a specialist. And then, oh, you've got digestive issues, we're going to refer you to a GI specialist. Oh, you've got some skin rashes, okay, a dermatologist. And it's everything just carved out into different specialties. No one's actually looking at the big picture. Whereas in TCM, we're doing the opposite of that. We're looking at the whole person. We don't see you as little pieces and parts, right? We're not the type of healer that you're going in and let's say you've got some pain in your right thumb, and meanwhile the doctor comes and all they're looking at and focusing on is that pain in your thumb. Meanwhile, you've got a huge rash on your ankle and they just act like they don't even see it, right? What we do in Chinese medicine is we look at all the puzzle pieces and we figure out how they are put together. And that's how we help put you back together. An interesting thing specifically about autoimmune issues is that they are exceptionally common among a certain type of patient. And I generalize by calling them caregivers. They might be actual caregivers in that, they might have young children, maybe a child with special needs, or maybe they have another older family member that they're taking care of, or maybe they are in the healing or helping profession. It could be a nurse or even a teacher, or they just have that personality. Everyone knows someone who's just always putting other people's needs before themselves or prioritizing other people's needs before their own. And we call that in Chinese medicine, you're kind of you've been pouring from an empty cup, and suddenly the symptoms hit you like a brick wall, right? Like as if Humpty Dumpty just kind of fell off the wall and shattered into a million pieces, right? This whole time, our bodies are resilient, and you might be running on adrenaline for a very long time because if you don't do it, who will? I'm just going to do this. I'm just going to take care of this. It's okay. I'm fine. And just one day, it just the adrenaline fades. You have something changes in your life. Maybe you're hit by a virus, and you realize you've been pushing through too long on an empty tank, and then everything falls apart, right? And I've heard so many of my patients say, why is this happening to me? It's not fair. It's not fair, that it's happening to me right now. Like, I don't get it. And the reality is, that your body you've been pushing and your body has been holding itself up pretty well up and until that moment where, okay, that's the final straw that broke the camel's back, and all these symptoms seem to just pop out of nowhere. So it's Chinese medicine, acupuncture. We see miracles every day, but I say they're really slow miracles. It's not an overnight fix. In a lot of the cases, it took a long time for you to get to this point, and it's going to take some time to heal. But our approach is, we have to fill your cup by treating the root cause of what's happening. And that is, what is the imbalance in your body that is showing up as these symptoms, as the pain, as the fatigue or the brain fog. One of my patients said, I feel like up until I started acupuncture, I've been just going around and all the doctors are playing whack-a-mole with me, right? And that's essentially what they're doing. You have pain, here's a pill. We can't fix your problem, but at least you now you can't feel anything in your body. Sometimes those pain pills work, sometimes it doesn't, right? One of my patients, she had been coming, she was a mom of young children, and she definitely fit the classic, she was just one of those people you could tell she was just, everything was for her kids, for her family, for her friends. She was really minimizing her needs and herself, and we suspected that she had some sort of either fibromyalgia or some sort of autoimmune condition, because stuff wasn't just, she, in her words, she said, I'm just a mess. Everything hurts, and then my digestion, everything. It's just I'm not getting any answers. So I've been working with her for a couple of months, and it was amazing to just see the transformation. She went from not being able to work, she was on disability, to going back to work, and through acupuncture, lifestyle changes, and all of that. It took some time, but yeah, by the time we were, about 6 months in, we really started to, make some improvements in that, in her overall well-being, her overall quality of life. And let me tell you, in that whole time, she was still trying to get answers from her doctors. And they just said, well, just take some time off work. I'll write you a note to get you out of going to work, right? And this is the kind of experience that a lot of my patients go through, and just kind of getting the runaround, not really getting anywhere, playing whack-a-mole with their symptoms. And with this patient, she came to me, she had gone back to work, she was feeling a lot better, and then she said, I finally got a diagnosis. I have Hashimoto's. I knew it was autoimmune. I knew it was something. And, I finally got the diagnosis, but you know what? There was nothing, there wasn't anything that the doctor told me that I wasn't already doing. And, had she waited for, them to figure things out, she would have not been at the place where she was now. And, this is what I admire about patients who are struggling with chronic conditions like autoimmune disease, is that they really have to be resilient, and they have to really be their own advocate for their health. And it's really hard to do that sometimes, because it's so exhausting as it is. Even if you're 100% healthy, just navigating the healthcare system, trying to get answers, it's frustrating. It takes time. And imagine doing that when you're also suffering from pain. You're also just really, really tired at the end of the day, right? So, the way that they're being treated too. It's just, you're a medical mystery, or yeah, no, we know what you have, but we can't do anything for you. And it's tragic that people are suffering like this, and they're not being told, they're not being given the tools and resources to help. And that's why I'm so passionate about what I'm doing. I try to listen, because I think that's also what is missing in modern medicine. It's a lot of, what do you have? Okay, let's look at your labs. All right, okay, gotta go, right? And there's a lot of hope that I see for this medicine too, in terms of helping people with this type of chronic pain, chronic conditions, because something has to change. We we talk about holistic medicine, even almost 20 years ago, when I was working in public health. There's all this talk about patient-centered care, culturally competent care, patient-driven care. And it sounds great, I'm all on board, but to really embody that, to really do that is it's not an easy thing to do. And what I strive for is to really listen to my patients, and focus on the individual and take the time to listen, because in Western medicine, we like to categorize things, autoimmune, this, you have this, you have that. And it's helpful to know what you have and why you're suffering, why you're having this pain. But there also needs to be better tools to address it. And it's, I think we're getting a little closer to that, in the last 20 years. I think there's a greater awareness in general about, this holistic approach to healing. But we still have a long ways to go with that. And today is also Lunar New Year. For those of you who celebrate, Happy New Year. And this is the time of year where, when we see each other, those who celebrate, we just greet, Happy New Year, wishing you wealth, abundance, happiness, and health. So maybe to just close, I want to just, let's all think about, what do we mean by health? How do we define that? Is it simply the lack of disease? Is it, having the perfect numbers on your latest lab tests? Or is it just being free from pain, being, not having any diseases? Or, what else? It's going to be different for everyone. So I'll leave you with, what I define as health. And that is, a state of being in your body and mind that allows you to reach your fullest potential as a human being. And so with that, I wish all of you happiness and health for 2025. And thank you for coming to our talk today.
Thank you so much, Teresa. Thank you especially for those closing notes of thinking about our own definitions of health. I think that's a great way to move forward from any sort of like gathering and reflection around these topics. And really grateful for you sharing your thoughts on the care capacity of acupuncture and TCM, especially in caring for those with autoimmune diseases. And after hearing you both speak, I'm sure there are some questions in the audience. We also have some questions ourselves, Rhiannon and I, and I think we'll turn to the Q&A section now. And to start, I wanted to I have a question for Bára, which is, so when I'm reading, often I'm forgetting my own body, but Bára, your book, New Infinity, actually attuned my awareness with both emphasis and care to my body. So, what are some ways embodiment shapes your poetics, and how does this relationship of poetics and embodiment figure into your own acupuncture practice?
Thanks so much. Really good question. Yeah, I think a big part of writing this book was this re-embodiment with myself after going through the medical um, complex, and in the process having, a lot of different language and a lot of different timelines and a lot of things attributed to my body that I then had to learn and to understand. And in that, it's kind of disembodying because I'm as Teresa said, it's there's all these the doctor whack-a-mole. You're sent to different doctors, and your systems are kind of separated from each other, and in that process it's confusing, and almost your own self knowledge is invalidated and confused in the process. And so in the process of writing the book, it was a lot of taking this language and like actually physically cutting it up, like medical books and different documents, and then like trying to put it together in a way that felt transformative or embodied, and helped me kind of like move through and reconnect. So kind of just, yeah, like shaking it all up and re-putting it back together, and almost trying to have like an embodiment meditation out of it in the end to kind of, re-emerge. And I think that in writing this book, and in that those small transformations that we can even find in language of how we and speak with our own bodies or whatever, I think all of this definitely led me towards acupuncture. The Chinese medicine framework has so much space for transformation and healing on levels that that the Western medical complex takes away from us. So, there's many ways that this transformation happens and can happen, and ways that we can listen to ourselves and our bodies, and that is TCM reminds us of that we know ourselves, and listening is such a huge part of healing. So that's kind of how the book kind of led me to acupuncture. So it's cool to have this opportunity to have those worlds come together in this conversation.
I love that idea of reintegrating the component parts and moving towards a more holistic picture of health and the body and wellness in general that seems to be just so missing from our current system. I have a question for Teresa as well on the same topic of embodiment. So you spoke a little bit about the embodiment of true care and moving away from performative talk about patient-centeredness. And you can just tell from the way you speak about your patients how much empathy and care and time you give to them. So it was a real treat to hear you talk. So the question is, from your beginnings in health policy research towards your last 15 years as an acupuncturist and TCM practitioner, what are some changes in your understanding of embodiment of care, both for yourself, but also embodiment of just of the body, I suppose, for patients?
That's a great question. Yeah, so when I started off in public health, the area of research that I was in was, we were focused on the social and behavioral determinants of health. So not just looking at, what viruses or what causes disease from a biomedical framework, but from a larger framework of, how does socioeconomic status, environmental factors, violence in the community, childhood exposures, all of that, how does all of that affect the population at the population level? How does it affect health? And why do certain populations or subpopulations tend to have higher rates of, certain diseases or illnesses compared to other groups? So it's like a very, top level bird's eye view of, of health. And, we have to measure it in some way. And so we're always talking about how we're going to measure whether an intervention was effective. Let's look at health outcomes. What is it? Is it blood pressure? Is it heart rate? There was self-reported stress levels, things like that. And it was still very, I don't have the best words to describe it, but it felt like we never really got inside the individual. And it's not intent, that type of research, it's not intended to get into the individual, even though, we like I said, we want to, try to have more patient-centered care, right? Whatever that means to them. But it's still kind of like the body, the individual is this little black box, and we're just trying to tinker and see, okay, well, it looks like overall that the rates of cancer are lower in this population or that compared to that population. But it's it's not. I felt like I was just looking at numbers, right? At the end of the day, it's just numbers and not individual people. And certainly, it's a different way of thinking about health in general, because how do you really know what's going on in someone's body just by looking at their lab results, right? Or reading some doctor's charts, right? Reading some doctor's notes about what this person has, and it's always about what they have, right? They have this disease, they have hypertension, they have elevated levels of this and that. And so through, I had to unlearn that, right? And through the years, as I transitioned over to TCM, the foundation of TCM really is, very, has a completely like holistic bottoms up view of, the mind and body are interconnected, right? We are interconnected with our environment. It's not so much that our environment is, impacting our health. We are part of the environment. We are all, we think of ourselves as individuals, but we're also kind of part of the whole, right? And just because someone comes in and on their intake form says, I have this and this disease, I have this and this condition, I'm not treating a disease, I'm not treating a condition, I'm treating the body, right? There's no separation between the individual and whatever disease that they have labeled on them, right? It's to me it's all one, like it's inseparable, right? It's a state of being. That's all we are, and that's how I view the body now. It actually just came to me like, yeah, we're just globs of energy in a way, and everything's interconnected, and I just view the body so differently now. My understanding of how how the body works is just, yeah, it's just so different than, and it's hard as a practitioner because we still have to speak medicalese sometimes, and patients may not be familiar with this paradigm. They're just coming in to see me because they've given up hope on everything else, or they haven't gotten answers from anyone else. But still, what do I have? What do you think it is? How do I get rid of it? But it's just it's a manifestation, right? So I don't know if that answers the question. I feel like I just kind of gone off on a tangent, but it's yeah, if anything, changes in my understanding, it's that you just every individual is unique, and you have to just listen, and you can come in with kind of a framework, but the reality is we're all like the body is in constant change and movement, and you kind of have to just go with that, um, rather than trying to categorize all the time.
I love I love that closing thought, and also the thought that you were just saying about um, not treating a condition but rather a body, and really specifically looking at those different bodies. I think that that really is such an enlightening thought to take away. Thank you so much for your thoughts, and also thinking about like individual bodies. Um, I feel like there's also each of these bodies having with chronic conditions are having different experiences of time. And Bara, I love how your book runs on sick time, warped and thick with waiting and spilling beyond the calculated containers capitalism works so hard to enforce. And I'm wondering if you can speak some more to the relationship between sick time and capitalism in relation to your poetics, and or the kind of philosophical questions, possibilities, portals, infinities, to steal from your title, sick time opens us up toward.
Good question. Yeah, I think like there's just something about autoimmune disease, like Teresa was mentioning, that it's you never know what it's going to be. You never know moment to moment, minute to minute. It can be so unpredictable, and our society is so contrary to that. It's trying to have the 40-hour work week, this very like labor oriented structure, production oriented, that when you have autoimmune disease, it's very it's very antithetical to that. So yeah, in thinking about poetics in general, and how we find meaning and whatnot, in the ordinary things of every day. So thinking about what does it mean to have autoimmune disease and have to function in this way, within capitalism, from a philosophical point of existence, like what is existence, and in a way it opens us up to what existence is outside of those structures. It reminds us, and even if you don't have autoimmune disease, everybody has a body that doesn't adhere to the capitalist constraints that are on us. Everyone has, some day that things just aren't going the way they planned, or it can be a physical thing, or it can just be serendipitous. And these moments can remind us, who we are outside of that, and what meaning is, just to be a body on, yeah.
Or as Teresa would say, globs of energy running on our own time.
Exactly.
Um, and along those lines, along that line of the question of uncertainty, there's also so much uncertainty around why autoimmune diseases occur, and also how to treat each individual person. And so I have a question for both of you, actually. Teresa, as an acupuncturist, how do you approach uncertainties around autoimmune disease care and treatment? You spoke a little bit about it, but wondering if you could share any reflections from caring for patients with chronic illnesses that are fraught with nuance and also possibly completely unanswerable questions. And then for Bára, New Infinity takes up a lot of that uncertainty and addresses it with various forms. You mentioned a little bit before about the forms you use, but there's poetry, prose, and experimental blends that refuse categorization altogether. and also different styles, surrealist styles, meditative styles, and comical. So the question for you would be, in what ways does your liberated use of form and style in your writing reflect the experience of navigating living with an autoimmune disease? So maybe we can start with Teresa and then move over.
Yeah. So, in uncertainty, I think most people are uncomfortable with that. As humans, we, especially in our like the capitalist world, right? We got a plan. I want to know I need to know what to expect, right? And sometimes, yeah, that it's not possible with our bodies, whether or not you have a chronic illness, right? Just in general, in life in general, and that's really tough when you're suffering. When life is good, sure, okay, yeah, I can take a little bit of unpredictability, but if you're really suffering through it, it can be really hard. And the way that I describe, this just talking about time, um, in Chinese medicine, Chinese cosmology, time is not linear. Time is cyclical, and maybe not even cyclical. It's a spiral. So, the way I see it is that even if you can't predict what's going to happen tomorrow, you know that eventually things are going to turn around and you're going to be not back where you started, but you're going to be on a different plane. And the best we could do is estimate where we're going. Like I actually told my patient this recently. We're going to go with a hypothesis that this is the direction we're going. If we notice there's a shift, then we kind of turn back and go the other way. But we know that there's always going to be uncertainty, but sometimes it's just a reminder of, okay, you know what, this is bad. I'm in a bad place, but I know that the tide is going to turn. And we're going to come back around. And next time we're going to know a little bit more than what we did before. And so, yes, we are spiraling up. And, but it's, I get it. Sometimes it's just hard. No matter what you do, it's just difficult to be in, and you just have to sometimes I just have to hold their hand and listen, and we'll ride this out. And some days that's all you can hope for.
I really like what you said about time and spiraling. It's now that you mentioned that, I realized that I wrote a lot about spirals in this book, and that was even before studying TCM. So it's cool how it kind of once again led me there. But to answer your question about time, I kind of tried to play with just the contrast of day and night, and how daytime, where we have these constraints, daily constraints, there's certain ways we're expected to be, and it's more linear, and it's more so there's the more fiction pieces that are kind of like the daytime, and then at night it's kind of like the subconscious deconstruction of that, where the poetics kind of come out, and the truths, or the more philosophical or the meaningful aspects of like what you went through in the day are processed in your subconscious or dream life. And so I kind of tried to play with those dichotomies of getting thrown around by capitalist time, but also in that finding your own time and finding your own spaces for healing. And with autoimmune disease, sometimes it doesn't align with the day or night cycle, the times of like when you have to sleep for a day or 2 days, or you have to push yourself to get some more structured things things done. So yeah, that I kind of tried to express that play of autoimmune disease and dance through that yeah, like deconstruction of form, but also adherence to form.
I really had that experience of what you're describing while I was reading, because you kind of like moved so swiftly between these different forms and styles, and it was so impactful. And to everyone here, I really, really highly suggest reading Bara's book. It's so fantastic. Um, Thank you so much for those answers. Before we close, we want to just ask if for both of you, any reflections on each other's practices or thoughts from tonight. Having two acupuncturists in the room it's so great to have both of your different perspectives and experiences. Maybe Teresa could start and Bára could wrap us up.
This was such a fun event for me, and I love connecting with all of you. And Bára, I can't wait to read your book. I mean, just hearing the little excerpt of it, it's so powerful. And I think our voices need to be heard, right? We're in a society where the experts have the final say, and I think it's important for other voices to be heard and elevated. Like I said before, the patient, you are the expert in your body. You are the expert of your health and your body and what you need, and that needs to be louder than all these experts on the internet or your doctor. Much respect to people in the healthcare field, but I think that's what's missing, and I think it's so important that we hear more from the people who are living in the bodies that are struggling with chronic illness. So thank you for putting something out there for the world to share.
Thank you. And yeah, thank you so much for sharing so much of your wisdom and experience. I think Chinese medicine is really amazing because poetics is so ingrained in the medicine of it. And yeah, I think the poetics that I was looking for in my book led me to practicing TCM, and I think that's really amazing. And every shred of wisdom is so integral. And yeah, just as someone who didn't grow up with TCM and found it later in life, and as a sick person, it has yeah, been completely life-changing. And yeah, so thank you for all the wisdom you shared with us today. And yeah, thank you for creating this space and hosting us for today. It's been really, really fun.
It's so fun to hear you both talk. And yeah, like you were saying before, Bára, like it's the light and shadows. Like there was just so many reflective elements between the different things you were saying. So this was really special. So thank you so much, Teresa and Bára, for sharing today and leading us through such a informative and thought-provoking discussion. And thank you to our audience for joining tonight. It was a really wonderful room to be in.
There will be also a recording posted on YouTube for anyone who wants to revisit any part of this conversation. So yeah, next month's event will be held on February 26th on the theme of palliative and end-of-life care. We'll be joined by the poet Eve Joseph and palliative care physician Jacqueline Hui. But until then, thank you so much again, everyone, for joining us. Thank you, Teresa and Bára, for the wonderful evening. And Happy Lunar New Year.